State Senate Health and Human Services Committee to order, and if Senator from the coast, Chairman Hodges, number 10. There you go.
Would you pray with me, please? Dear Heavenly Father, thank you for the many blessings you've bestowed upon us, Lord, particularly the opportunity to be here today and as a group to tend to the affairs of our state. Lead us and guide us in all we do. Give us wisdom, and these things we ask in Christ's name. Amen.
Amen.
Thank you, Senator. We appreciate that. We have, we're going a little bit out of order here with the way we're doing the bills today, because we have some people like Appropriations Chair that's still working on balancing a budget. So we're going to go with HB 1374. This is Chairman Hawkins and Chairman Tillery. If y'all want to both come up, it'd be fine, and wherever y'all want to be. And so just let me just sort of set the groundwork today. We have about 6 bills that we're going to do today. We have a limited amount of time, so if we can be as concise. All of these are department or agency bills, so they have been ironed out. We have looked at them from the House and committees and rules and here, and we've looked at them again. We're going to look at them again today, but we much appreciate that. The floor is yours, Chairman Hawkins.
Thank you, Chairman Watson. Before you, you have House Bill 1374. This is actually a bill that we passed, I think, about 8 years ago. I carried it back then. This addresses a new approach to payment for health care providers that was devised, where the insurance company would send the provider, instead of a check, would send them a sheet of paper with numbers to enter into the credit card machine.
Can I interrupt you just for a second? I apologize to the committee and to the audience there. The reason Chairman Tillery is there is that we do have a substitute, and the underlying bill is absolutely unchanged.
Right.
And Chairman Tillery, you're going to explain your portion of the bill, and Chairman Tillery is going to explain his portion of the bill.
Yeah.
It is in your folder, and it is a substitute, House Bill 1374, LC 492816S. So make sure everybody has that. 492816S. I apologize.
That's okay.
We should.
No.
I should have said that from the outgo. No. All righty, back to the star witness there. Okay.
Okay, I haven't seen the substitute, so the line I may refer to may be the wrong line, but the change in this bill from the old method, and the reason we're doing this is because there were some workarounds that happened, and now they're back to sending these pieces of paper with the credit card dial-in number, and again, our providers do not realize that they're actually paying to be paid. And so at the end of the year, what that means is our overhead goes up, because we're losing 2 to 5% on about 80 to 90% of all income. That's where insurance has gotten to. So at the end of the year, you meet with your folks, and they say, oh, you got to increase your fees up to here to stay where you were last year. So this is driving the cost of health care. So what this bill does is it says express acceptance makes a clear and direct agreement to the terms of payment method communicated expressly by the health care benefit plan to the health care provider in writing, and simplifying acceptance of payment method. So in other words, this is an opt-in now in writing that the provider or his agent signs, and it stays like that until they change their mind and want to be charged to be paid. That's it. I couldn't hear you. Yeah, if they want to be charged to be paid, they can go ahead and sign up for the virtual credit card.
All right. Yeah. Do we have? We're going to let Chairman Tillery present.
Well, thank you, Chairman Watson. I appreciate Chairman Hawkins for letting me
right along with him here. You know, we've had a debate for a long time when folks enter into state contracts, they have to go through procurement rules. And the procurement rules for entering the contract are different for renewals. So you can enter in, and I'm going to give you wrong numbers, but they change based on how you're entering the contract. You can enter in if the department may not have to go through certain procurement mechanisms if the bid is less than $5,000. So you enter in for $5,000, and then you renew it 1 year later for $1,005,000. That has always frustrated me. It has been irritating. I think it's just a way to get around state procurement. So what Section 2.1 does basically says if you're renewing, and it's going to be above these amounts, you got to go through the same process as you had to if you were first getting it. It's just a good government bill. There's nothing else to it. And hope it will help us stop some of the games that folks think are fun to play with state dollars.
All right, does anybody have questions from the committee? So you are on 4. Okay.
Senator Tillery,
Yes.
are you attempting to add integrity to government?
It's a heavy lift.
I know you did that last week with your Epstein Amendment, and I'd like to try to do that with dollars.
Thank you, I appreciate that.
All right, no further questions. Late arriving question here. Please bring that mic up to you. Is that number 1, Central Rock? 2, okay.
Thank you. So is the meat of the bill, is it that paragraph A on the last page, 167? No contract for any purchase that was effectuated without competitive bidding solely because the contract price did not exceed it. Can you explain that paragraph?
Yes, ma'am.
It looks like it might be the heart of it.
You're absolutely right, Senator Rock. If you could enter into the contract, not have to go through competitive bidding, we're not going to let you renew the contract above competitive bidding prices simply because you were in. There are different rules once you're
That's
the contractor.
So that's
You-
it.
Yeah, you shouldn't be able to game the system to low ball to enter and then explode on the backside through no bid ways.
Thank you.
All right, any further questions? If not, I'm happy to entertain a motion. Okay. I'm sorry, 4.
Mr. Chair, on line 39, I just want to be clear, where it says method communicated explicitly by the health benefit plan, health being the right word and not health care benefit plan, is that correct? Because I know it's
Yes,
health.
It's
Health
healthcare, yes, healthcare.
Okay, so the word there is health. Should that be health care on,
Well, it is followed plan to the healthcare provider, so health benefit. Legalese, that's the way they.
that was my question,
Yeah,
Doctor,
yeah.
since, thank you, I appreciate
It
that.
was legislative council, yeah. But thank you for the,
Yeah, I just trust the professionals.
yeah.
All right. All right. Looks like we got a motion and a second, maybe.
I motion that we do pass.
All right, motion do pass, and let's see, and we have a second.
Yeah.
Just want to make sure, so we have a motion to do pass 492816S, and I have a second. Any further discussion? No discussion. All those in favor say aye. All those opposed, like sign. Passes unanimously. Thank you. And did we decide Tillery's going to be carrying this, I presume? Okay.
I'm happy to if you want me to.
Thank you. All righty. So we're going to ask and you know, I presume that the folks who signed up to speak for that, apologize. We're speaking in favor. Yes, okay, I apologize. It is entered that MAG and GDA both are in favor of that. So next bill is, since Chairman Hawkins is in that seat, we're going to do 1278. Let him get that done and get on his way.
Thank you, sir. 1278 addresses an issue that was brought to me by the Board of Dentistry. Right now, per code, each time a dentist applies for a sedation permit, it requires an in-site visit. That means the dentist goes to the dental office. They're having trouble now finding dentists going to especially the Southwest and losing a day out of their office to do these sedation permits. And, you know, time has changed, and you can do these by Zooms and things like that. So this is, they've asked for the consideration of this. We feel like it will increase the number of sedation permits, which are primarily used for those young folks with behavioral problems and some young kids that just can't stand to sit still or have anybody, you know, work on their mouth. That's the bill.
Do we have questions from the committee? No questions? All righty. It's not that many words, you're correct. It's pretty straightforward. And anybody have a motion to pass from Chairman Robertson? Senator Mangum is second, and this is LC 521018. And we have a do pass. All those in favor say aye. All those opposed, like sign, passes unanimously. All righty.
Thank you, Mr. Chairman, and thank you, committee.
Yes.
Good, I wanted to share that longtime chair of the House Committee on Health, Buddy Childers, has just passed away in Rome, Georgia. And he was the chair probably for 25 years of that.
I'm sorry to hear that.
I appreciate the opportunity.
Thank you. Thank you for doing that, Senator Allrock. All right. Leader Estration, House Bill 1396.
Thank you, Mr. Chairman, members of the committee. This is LC 560608 as passed in the House. Over the past few years, the General Assembly has made substantial investment in addressing the unsheltered homelessness problem, particularly in the city of Atlanta. There have been substantial funds expended of local, state, and federal dollars, including in our budget this year. I've worked on this issue for several years, and this I view as the next step in the process, which really revolves around the data collection component. So all organizations receiving state funds must enter into the HMIS. It's a Homelessness Management Information System administered through DCA, those who are being served and the nature of the service. What this would require on a very limited scale, it would just be within the city of Atlanta and just for private organizations administering outreach services or operating a shelter within 1,000 feet of certain public facilities such as schools, universities, that they too would have to enter into the HMIS system. Now, this is important, I believe, because number one, we want to make sure that state funds that are being expended are spent as efficiently and effectively as possible, but in my mind, more importantly, that unsheltered homeless individuals are actually receiving the services that they need, and having the data so that we can better analyze what services they are receiving, I think is critical for that analysis. I'd be happy to answer any questions, but I tried to draw the bill so that it would just narrowly apply to have this limited focus and data set for future analysis. Thank you.
Any questions from the committee? Senator Merritt, you're on.
I'm on
11, thank you.
Thank you, Representative. I have a few questions. Number one, why are we targeting just the city of Atlanta? If we want to really address homelessness, I think this would be statewide. You are asking for state money. And does the city of Atlanta know?
So,
You work with them on this.
So initially, the previous draft was much more broad, and my concern is that there may be unintended consequences or private organizations captured in other parts of the state. As we're rolling this out, I think that initially doing it just within Atlanta and just within these, for these limited locations within 1,000 feet of certain facilities, I think is a more limited means by which to ensure that these nonprofit organizations, organizations not receiving government funds aren't unintentionally captured, that if we have a limited area in which this applies, it would allow us to incrementally put this in place.
Okay, my next question is, wouldn't this be an unfunded mandate for the city of Atlanta? And have we even looked to see how this impacts like training, support, technical, anything? And again, my question is, have you checked with the city of Atlanta on this at all?
So the city of Atlanta has been contacted about this legislation, as I understand, and although I've not heard it directly from them, they have no objection that I'm aware of to it. To answer the first part of your question, it's not an unfunded mandate, because what we're dealing with are organizations that would be choosing to provide these outreach services. There's no obligation on the city, and to ensure that these well-meaning organizations, I mean, my heart goes out to, these people are trying to help, but that there wouldn't be a characterization that it would be some sort of criminal violation. So it states here that it would just be subject to a non-criminal citation.
Okay, this has to do with line 6 and 7.
Yes, ma'am.
You have that there are this is a non-criminal citation is necessary instead of a civil administrative process. Can you explain that? That's on the line 6 and 7, I think.
Yeah, the intent there was to, and working with legislative counsel, the intent was to just ensure it would not be a criminal citation, that no one would be charged criminally based upon this requirement. As far as I think you may be talking about.
Civil administrative process is what it
Yes,
is.
ma'am. I mean, I'm a former prosecutor, but I'm not sure it seems to me this is as light a touch as you can give, that effectively they would get a warning if they weren't using the system.
Chairman Robertson.
Thank you, Mr. Chairman. Leader, thank you for bringing this legislation forward. Would this be applicable to churches that provide those services that you're talking about?
Yes, sir.
Okay, because what we have found is that there tends to be a lot of individuals congregating in those areas. And when we look to provide services for the state, would you not agree that a lot of times we miss the data in order to understand exactly how big the problem is?
Yes, sir. I absolutely agree.
Okay, thank you. I appreciate that.
Thank
and,
you.
And there was a question asked about the impact on the city of Atlanta. The impact would actually be on the organization that was offering the service, right, to where they would need to be reporting this information.
Yes, sir.
It wouldn't be the city of Atlanta's responsibility, would it?
That's exactly right. Correct. It
Thank
would
you.
not be the city of Atlanta's responsibility.
Thank you.
The city of Atlanta works with these organizations.
All right, Senator Allwright.
Thank you, Mr. Chairman. I had a brief time to speak to the author of the bill before we convened.
Senator Allwright, you mind grabbing that mic a little bit closer?
I'm concerned about this bill because it, are we drawing a bill here to address the situation at the Capitol? Is it people inside the Capitol that are concerned about what's happening across the street? I mean, that we have Central Presbyterian has an outreach center and offers a lot of services to homeless people. And the Senator just mentioned people congregating. What are we trying to, what is this heavy hand of the law on private organizations?
All right, is that a question there?
Yeah,
Okay.
why are we using the heavy hand of the law and having?
All right, so we got it. All right.
What does the language say? Issuing a citation by a policeman for a violation, and the violation is not entering something into a database. It's just, this it kind of eludes me as to where we're going with this.
What we're trying to capture is organizations that may be outside of Atlanta that are coming to Atlanta to provide outreach services and who may not be providing data, are not providing data, which is critical so that organizations to assist unsheltered homeless can use those dollars most effectively, that the state, which is appropriating dollars that the taxpayers' funds are using most effectively, and that, as I said previously, that unsheltered homeless are receiving the services that they need.
You can, wait, hold on just a second, got Chairman Kirkpatrick over here.
Thank you, Mr. Chair. Just a couple things. So DCA would be accountable for administering, they administer the HMIS?
They already do.
Because I think we all know we've seen a lot of struggles with the PIC count that happens in January every year, and that data is very incomplete across the state.
Completely agree. Yes, ma'am.
So would this help us with getting more information more consistently?
Yes, it would. And it would help to, I think, also track the unsheltered homeless individuals who are receiving those services, as well as the organizations that are providing that support. It'd help in both ways.
Senator Mangum.
Thank you, Mr. Majority Leader.
Yes, sir, Senator.
Are we targeting persons who are only receiving private funded organizations that are only receiving government state funds? Or
Those-
just any church? If my church wants to go out here and feed 11 people, am I going to be required to register in this registry?
If you're receiving state funds, you're already required. This would capture organizations that aren't receiving government funds that are providing the services within this limited area, these outreach services within a limited area. And you can see it here. It's medical care, clothing, food, or shelter.
So
Hold on, Chairman. Senator Mangum, you have one more question, follow up there?
I need to get kind of clear on this. I'm very, very troubled with the government stepping into, there is a separation of church.
Is there a question here?
Yes, sir.
All right, let's go.
I'm very troubled by this legislation requiring a private church, for example, to register, or the government requiring them to do anything. And I'm trying to understand what is it what data are you requiring, and for what purpose?
Yes, sir.
What is whether it's compelling or otherwise?
Yes, sir. So the short answer is, in my meetings with the city of Atlanta and with leadership with the city of Atlanta, a big problem is that well-meaning organizations will come into Atlanta and will say, hand out food, which then leaves trash everywhere, which then makes it impossible for the city to know the individuals who have been served. I mean, we're talking about all kinds of different services that are being offered without any planning in advance, without any permit to offer those, with concern as to the safety of these outreach services that are being provided. There's no oversight whatsoever. These are organizations that are well-meaning, who I am not trying to cast doubt on their well-intentioned, but it is an issue for the city of Atlanta right now that these folks are coming into Atlanta and doing these things. And so the first step, I'm not seeking to criminalize that. I'm not seeking to take any punitive steps toward these well-meaning, often faith-based organizations whatsoever. All we're saying is that we just need to track we need some data as to what is being offered and to whom it is being given.
So am I to understand we need data to determine who is causing trash?
There's all. I invite you to
think-
talk to this.
Listen, I'm not going back and forth here. So anybody, Sally, Harold, I'm sorry.
Yeah, so I'm
Chairman Harrell.
trying to figure out what you're trying to get at. Collecting data is good because it documents the problem. Is that correct?
Yes.
Okay, so why wouldn't you collect it from everyone then? Why are you targeting just private funded organizations that are 1,000 feet from a school, a child care center, or a public park?
First of all, as I said earlier, those receiving government funds are already doing it. The issue is that within certain areas, that those are not, we don't have a means currently to track that or to get that data if it's a privately funded organization providing the outreach services. So the idea was to do this on a very limited scale in a very limited area so that it could be monitored and that frankly the folks providing these services could be informed and educated about the HMIS system so that they could begin to implement it.
So choosing to do it for only organizations that are 1,000 feet from a school, a park, or a child care is just to make it, and privately funded, is just to make it small? No other reason for why you're targeting things that are services that are close to these categories, child care, school, park?
So the reason that comes to mind for me is you can quickly identify organizations that may be doing it within certain proximities within the Atlanta area and say, okay, you have a shelter in this location. Here's the HMIS system. Maybe you aren't familiar with it. Here's how we can get you logged into it. Here's how you can begin tracking that data. The idea was if you did it on a very small scale and helped these well-meaning organizations to get into the program, that would help to streamline that process. You wouldn't have a huge, if we try to just do this, require it statewide everywhere, that would be incredibly problematic. If we can do it on a much smaller scale and be helpful, I don't want to stop these good deeds that are being done. I just want to help ease them into the data, this data system which is already established, so that we can get that information.
You can do that under discussion if you want to. All right, Senator Ulrich, you want to circle back here?
I do because I had.
There you go. You got it.
Thank you. I had not finished the points that I wanted to inquire about. This language is true places organizations in a violation posture. I mean, it seems like it's coming down on organizations as though they're a perpetrator of some sort when they are out of the goodness of their heart trying to offer services to those in need.
Senator, I adamantly disagree. I have worked very hard to make it clear that this is in no way to prosecute or pursue well-meaning organizations. This non-criminal citation is language with which I think what you just said is clearly not the case in this bill.
Have you spoken with the Central Presbyterian leadership about this approach? They're right across the street and have conducted for over 25 years the kinds of programs of delivering services.
I have not spoken to Central Presbyterian. What I would just say is the objective and intent here is to capture, in many cases, organizations which are not located in Atlanta but come to Atlanta and are a source of complaints or are a source of issue and consternation for the city of Atlanta because they are outside, or they're organizations outside of the city that come into Atlanta and provide services without the proper process being followed to provide those services, and with a real impact to the city.
So there's a process being violated by them. You say they're not following the proper process now?
Right. If you look again, I really do not. I think any attempt to characterize this as looking at charitable organizations looking to do good as this being in opposition to them, I think is very unfair. What I would just say is this, that organizations may come in and say hand out food and do not follow the City of Atlanta's process, or offer other services that don't follow the City of Atlanta's process that's in place to provide those services. And it's being done to individuals, unsheltered homeless individuals, who I think we need to be assured are going to be safe, and that and so step one is to provide the data rather than just the onus being on the police or a code enforcement officer to go out and simply say, you can't do this, it's a violation of Atlanta's city code. Step one is to get the data, get them participating in the HMIS system so that we can ensure that that's part of the overall plan for how we serve and assist unsheltered homeless.
I think that's very laudable. Really appreciate that. I'll recognize We'll get that a discussion. Chairman Robertson.
Yes, Mr. Chairman,
Recognize him for a motion.
at the right time, Mr. Chairman, I'd like to make a motion to pass.
It is the right time.
Thank you.
And second from Senator Cowsert, and now is time for further discussion if you have it, because this is what this is boiling down to. Discussion will recognize you. Senator Merritt.
So I have another question.
You know what? We're out of questions. This is discussion, because that's what it's been anyway. Let's do
Okay,
it.
well, I'll discuss it with you. This is my discussion, or this is my issue with this bill. Again, I understand the city of Atlanta is working with these organizations. I think we're all in agreement there. I'm clear on that as well. However, has the city of Atlanta expressed any widespread failures? Are they asking for this data collection? I have concerns that you have not properly engaged with the city. I have not heard, I don't think anyone from the city has come here to testify that they're seeing failures in these organizations in the city of Atlanta, and I also have an issue with us
Senator Merritt,
targeting
we
a
all
specific
appreciate what you
city
have. We certainly agree
and
with your
not
thoughts.
make it a widespread.
All right, Senator Monahan. Listen, we got it. You disagree with that. We got that full, loud, and clear. Senator, there you go.
I'm very puzzled. My colleague to my left seems to know a little bit more than I do about the proper procedures, and I have so many questions that it's ridiculous. I have served meals on these streets to homeless people, and me personally, I have given out more than 11. So I can see myself being in violation. I don't even know the process. We have a problem, Mr. Chairman, with homelessness. I abhor, in fact, I, from the well, spoke of it when I first got here, that I don't like passing by people sleeping under the bridges. We need to do something about it. But I don't know what the purpose of this data is, how it will be used, and what these quote-unquote failing to follow the proper process, what is the process?
All right, we appreciate that.
And I need to be educated.
I have a follow-up with that, with Senator, our Vice Chair, and
So-
just listen here.
Yeah, if you look at the DCA website on the HMIS, the purpose is to generate an unduplicated count of homeless individuals and analyze needs and prevent duplication of services and measure outcomes. So, I mean, I think we've got big holes in our data. We keep throwing money at homelessness and not making enough progress. So I'm just, there is a reason that this thing exists, and to try to, we've got a system that is not working very well now, and part of the problem is we don't have good data on who's providing what, and are they making progress? Do these programs work? So that's what it says on the website.
Mr. Chair, and to the committee, I sat as the vice chair of the Committee on Homeless and Unsheltered, and what we discovered really quick is the January pick does not give us the absolute numbers. So we made a recommendation for an August pick, a January and an August pick, so we could find out who's out there living unsheltered or homeless at the coldest and at the hottest time. We made that recommendation, and none of the cities took that recommendation, including the city of Atlanta. I drive here every morning from where I'm living when I'm here in Atlanta, and I drive past homeless people outside and next to places that are supposed to be providing services. But every time we brought somebody in front of that committee and asked them for a number, how many homeless people were in the city of Atlanta and how many homeless people were in the other parts of metro Atlanta, nobody could give us good numbers. Everybody was making estimates, but most of them were asking for some kind of help. And I think that we have had failure. There's a man, a homeless man, who died in the city of Atlanta within the shadows of a church. Let that sink in for a minute, because I know everybody wants to walk right past it and act like it just happens everywhere, but it doesn't. And we have somebody that comes up here, gives us an opportunity to get data so that we can make educated decisions. And we shouldn't take everything as an attack when people come up because they happen to mention the city of Atlanta. I think this is good. I appreciate it, and I look forward to working with the leader and others who want to make things better and hopefully get something like this through.
I have a motion. Mr. Chairman. Motion to amend.
You're number 11 here.
Yes, sir. I have a motion to amend where it says City of Atlanta to make it statewide. If I agree with you, we have a
So
homeless
you
problem.
have, you have the words for that, so you want to,
If lead council can make those words and strike where it says City of Atlanta and make it statewide for the state of Georgia, that's what I would like. I agree with you. We have a
And I-
homelessness problem. We have one
I
in
presume
Gwinnett
you're-
County. It's not just in the City of Atlanta.
I'm opposed to it, but it's line 56 to 60 that restricts it to Atlanta.
okay, and you have a, is there a,
And
is there
line
a second?
13. I don't think
Fails,
they heard, I
fails
don't
for-
think they heard you.
Oh, I'm sorry, is there a second?
Second.
Second, okay.
Second.
And so, all those in favor of the amendment, raise your right hand. That's 4. All those against the amendment, raise your right hand. 1, 2, 3, 4, 5, 6, 6, 4, it fails, or 4, 6, it fails. Thank you. So it looks like it's been a motion, second, and all those in favor, raise your right hand. 1, 2, 3, 4, 5, 6. All those against? 1, 2, 3, 4. Thank you. All right. Thanks, Leader. Really appreciate you bringing that. And I mean, I think this helps delineate who is homeless, and hopefully we can help these people. I think that's your ultimate goal, and I really appreciate that. Hopefully this will give us some better data that we can work on.
Thank you,
so
Mr.
much.
Chairman. Thank you, members.
All right. My chairman of my delegation, Representative Ron Stevens, HB 1329. All right, and the floor is yours, but we're talking, let's see, let's make sure we got the right LC 650071, and this looks like the annual cleanup bill. The floor is yours.
And to make sure that I'll talk quickly before we lose a quorum, Mr. Chairman, this is the annual cleanup bill, the drug update bill. Section 1 talks about drugs that are Class 1 narcotics that are primarily illicit opiates whenever they're changed their formula a little bit. And those don't have a medical use and they're highly addictive. Section 2, page 2 and 3 talks about all the brand new drugs that are about to be available, and I can tell you about all these wonderful conditions they're going to treat, and there's some pretty amazing stuff on the horizon. And Section 3 talks about the antihelmintic drugs and the vaccines that are there. Section 4 talks about epinephrine. Epinephrine Primatene Mist, as you might know, is over the counter. And Mr. Chairman, that's the bill.
All right, anybody have any questions? Just annual cleanup bill. It's not a cleanup bill, it's the addition bill, and a little bit of cleanup there. You've been on this committee before, you've seen it, and we've been here more than 1 year, you've seen it. So at the appropriate time. All righty, we got a late arriving question from the powerful Rules Chair, and here we go.
All in my own mind, Mr. Chairman. So you're essentially matching, it's the annual bill where we're matching the same schedule as the feds, correct? With
Yes.
these additions?
Yes, sir.
All right, what about, so the president has made some comments on moving, I guess, THC or whatever to Schedule 3. Is that, we'll just address that next year?
Yes, sir.
Okay.
Way overdue, I might add.
We might.
Yeah.
Just curious.
Just would like to know. Did you write?
like to see research on it.
Yeah, absolutely.
Hard data on it, research.
100%.
I know data's a faux pas around these parts today, but
Mr. Chairman, if I may have one,
We might have a discussion on that one.
if I can just add one thing, there's another bill coming before your committee that I'd just like to mention very superficially. 2 drugs that that have been researched in Emory University are going to treat 2 conditions that we need to address. One of them PTSD for our veterans that have been suffering for years, and also life-threatening depression for 2 drugs that
Yeah,
might come before
that's
you.
actually on Wednesday, so
It's a good
if we
bill.
get through today's session, so here we go. Senator Harrell.
Yes, my question is about line 771, which refers to the COVID vaccine. Why is mRNA struck?
That's a good question. That came to us, I believe, and I might have to go back to the physician here who was in the studies for mRNA, as I might recall. There are
So there are several more vaccines now that are not messenger RNA, just made in a different way.
I understand that there are a variety of COVID vaccines made in different ways, but
That's
why
right.
are we striking mRNA?
because it's included
Because
in
it will include all of them.
to include mRNA plus the rest of
It doesn't exclude
Oh, okay.
mRNA. So.
Okay, thank you for the clarification.
Clarification, there we go. Senator Kirkpatrick.
Yeah, appropriate time, I'd like to make a motion to pass.
Thank you so much. Do I hear a second? Second from our marijuana expert also. And any further discussion? All those in favor say aye. All those opposed say no. I heard nothing. Passes unanimously.
Thank you, Mr. Chairman,
Thank you
members of
so
the committee.
much. Am I carrying that?
Please.
Okay, all right, great. Happy to. Appreciate that. Okay. All right, can you keep that for me? I'm reminded that this next one also is a department bill, and Chair Lady Dempsey is up. And then we have the green jacket fellow back there. He's next. Okay, all right, thank you. Chair Lady Dempsey, we are on House Bill 1238.
Right.
And let's make sure everybody has that in their folders. And it is also not a substitute. It is Clean LC 600227. And there we go. The floor is yours.
Okay, so during the interim, I chaired a study committee in the House to deal with our children that are stuck in hospitals and psychiatric residential treatment centers after they have gone through crisis and are stabilized, or a medical issue and that is stabilized. Many times that foster parent or adoptive parent has been in a hospital setting multiple times, many times, and they have run out of the capacity to continue to care for that child. Or sometimes it is that is in danger to bring them back to the home they have been in. It's not that the parent necessarily wants to walk away, but there is just not the capacity to be able to do it. So this bill came from DCH. It was presented actually to us during the study committee that there was a mechanism they felt they could put forward to request, to pursue requesting the 1915I Medicaid waiver program. Excited that it was their idea, actually, and they brought it to us. This is to deal with children under the age of 21. So I know the Senate, I believe, had a bill that dealt with adults, but this is for that group particularly, and it will allow for many of the wraparound services and care and pay for that, which is the biggest challenge, to help families stay together, to free up capacity in the treatment centers and the hospital, and to help those children stay at home with appropriate care at the appropriate time, and that is all that this is.
Anybody with any questions or? All right, question, Chair Later.
Thank you, Chair Lady. And obviously, you know as well as I do that there are some other departments that are involved with this population.
Absolutely.
DFACS frequently gets involved with this population, and DBHDD frequently gets involved with this population. So I would think it would be very important for those three agencies to work together on this, and they've got mechanisms set up to do that. And I just wanted to ask you if you had had those conversations.
The reason we did the study committee, it actually started with a bill that was in the House, and we brought each of those agency heads and some of their staff together for a meeting, a private meeting, in essence, between them and myself. And at that time, it was more of a finger pointing of, we can't do that and we can't do that. While they all wanted to help, there are certainly issues around the word abandonment, when a child is abandoned and left there. There's a 6-month process actually right now in law because of that word, where it's kind of the hospital or the treatment center just has to keep them. And they might not be getting the care they need, the services they need, and they are left. And so this is one of the ways that DCH came forward with. Everyone wants to help, but I feel like we have to start somewhere, first of all, with finding the funding. The therapeutic care will not come in to take care of them at that time unless there is someone to pay for it. That's the greatest challenge. Hospitals and treatment centers right now are just basically eating those funds, just, having to pay for it. So it's a process to help, and it really is. It is, I think it has great potential to help families not feel they have to walk away and to intervene earlier at times, too. I think it's a good way to deal with this, because this is a real challenge. I had really mostly heard about adults that we hear stuck in emergency rooms, but that's not the only place that these children are, too.
Sorry, I have a question.
Yes.
Chairman Brass.
Thank you, Mr. Chairman. Madam Chair, thank you for bringing this. I'm just curious, when you worked with DCH on this, did they request a certain time frame to give them time to get together the waiver?
They have actually already made the application.
Okay.
We are in process. This is allowing for that to go forward. And the bill itself says that not later than December 31 of this year, that they will submit that request. So they are in the working phase of trying to do that. It was their idea, their solution, which is really exciting.
A follow-up, Mr. Chairman, if you'll allow. Can you teach me how to do that? Because I had given them a similar bill on an IMD waiver about 5 years ago, and to my knowledge, it still has not been completed.
I'll be glad to try to help.
Thank you.
You know I would.
All right. Any further questions, or you have a question, or?
Yeah, well, thank you for the bill, and it sounds like it's past time to address this. My very small question is on line 15, and maybe this is for alleged counsel, but out-of-home placement, out-of-home, isn't it supposed to be hyphenated? You're putting together words to describe placement.
So
And-
is this judiciary or HHS?
Well, no, it's
English 101.
Okay, all righty.
out-of-home.
Okay, Senator,
Is,
hyphen or not?
Yeah, yeah, because it's,
She's
you're
working
taking-
on it,
okay.
working on it. Okay, there we go. Let me recognize the governor's floor leader on number. Yeah, longest serving governor floor leader.
I don't know if anybody's actually fact-checked that, but it was a fun. Yeah.
And y'all meet with the governor every day, right?
I eat breakfast with him at the mansion every single day, Mr. Chairman. I actually, yeah, that's right. You can think that if you'd like.
I think
Sure, we all can.
Like the rest of us.
Seriously, and to go back, I'm not trying to make this judiciary, but I was talking to someone out in the hall, and I know there's two kind of paramount decisions, the Olmstead Act and the Family First Act, where we're supposed to provide these services in the least restrictive, most family-like setting. possible. I was going to ask, would you consider it a friendly amendment if at the end of line 17, we added in the least restrictive, most family-like setting possible to meet the recipient's needs, just to reinforce that in Georgia code?
So it would be line 17 where it ends.
Well, you wouldn't strike, yeah, you would strike the period, or make a
After where it says for the provision of respite care and related services.
Yep.
You're talking about strike the period.
and then put in the least restrictive, comma, most family-like setting possible to meet the recipient's needs, period.
It certainly sounds good to me. I think DCH is in the room. Would it be okay if they comment?
Please, if y'all wouldn't mind, just go to W1 if you wouldn't. Witness 1 would be great. Thank you. Just tell us who you are and who you represent, please, ma'am.
Yes, sir. Brandy Sylvan, Director of Government Relations with the Department of Community Health. I don't have any concerns with that suggested language. I did just want to clarify, though, some of the services that this waiver is intended to offer is primarily respite care and family training. So I think by default in nature, it is going to be in that home setting. You know, the reference to out-of-home placement is saying that we're trying to address kids who are at risk of out-of-home placement. That's the population that is intended for the waiver. So, but the actual services by nature are going to be designed to be in that home setting.
Okay. But
All
you
right.
would consider it a friendly amendment?
Yeah, I'm not our general counsel, but I think she'd sign off on it.
Okay, so,
I just wanted to ask the author, Senator Hatchett, I do think that's implicit in the way we're delivering care now. Are we tying our hands? This is just a real question. This is not a leading question. Are we tying our hands that if we did get this waiver and there was a flare-up and we needed to put somebody back in a non-community-based setting that was more of an acute circumstance, that we couldn't use the funds to cover that? I mean, do we need this, or are we unintentionally locking ourselves in and constraining what might come to pass? Maybe there's a season of time that someone would need to go back into a more acute setting for 3 weeks or 2 weeks or a week to get back. I just don't want to outsmart ourselves with that. And I don't know that I share a concern that if we don't say that we're going to get a waiver that's going to not deliver that setting. Is that a real concern?
in other words, less is better sometimes. I got you.
Less is more. I don't know why we'd want to constrain ourselves with that clause on the end of the sentence when we can find out, wait a minute, we need these dollars to cover these kids for this period of time for a week because they maybe have some acute circumstance. I don't know that we need to add that.
I think it just reinforces it.
So, Chairman Kirkpatrick.
I'm just trying to understand the bill, and it looks simple, but if you read it carefully, basically what the waiver's authorizing is the qualification of caregivers of the recipients of Medicaid for the provision of respite care and related services. So it's not, the people under 21 are already,
They're the
well, the ones
patients.
that are 18 are already eligible for Medicaid. DFACS doesn't have any jurisdiction over people from 18 to 21. So we're not talking about the recipients, we're talking about the caregivers. Is that correct?
So, and I do believe that that is part of the reason that the initial suite of services approved by CMS are services that are directly benefiting the child, the member. The ones that they said had to be offered through the waiver instead of through the state plan were geared more toward the family relief, right? The respite care for the family member and the training for the family member. So I think that that is kind of why that is worded the way it is.
So it's not, when you say caregivers, you're talking about, sorry, Mr. Chair, that includes the families or behavior aides or Does it include the hospitals?
So the behavior, those are already included in the state plan amendment services. So anything that is a direct service for the child is already in our state plan. This is just to offer those additional ones that CMS would not allow us to cover under the state plan. But talking with regards to the setting, this waiver would be for services in the home and community setting.
Thank you.
Right.
All right. Ms. Hamrick, did you want to,
We're in favor. NAMI, I represent NAMI.
so Ms. Hamrick represents NAMI, and she is supportive and waives for testimony. Thank you so much. Did you want to offer that amendment? I'm not sure it's going to pass, but I'll be happy to take a vote.
I would like to offer it.
All right,
If we
so
have the
do we have the
motion.
wording? Are we clear on the wording on that? You want to?
Is it a rationale? Is it basically just to clarify in some way? Maybe.
So, my understanding is that there's basically the Family First Act, and then an OMSED decision that says that services like that have to be provided in a family-like, in the least restricted, most family-like environment. And so this amendment reinforces that services will be provided
And
in that environment.
you know, again, I don't have any concerns with it. I don't know that it's necessary simply because this bill is just authorizing us to submit the waiver. You know, all of the details of the waiver would be in that application.
All right, so, all right.
But again, I don't have any
Gotcha.
concern.
All right, so why don't we do this? So can you read your amendment to us one more time?
Yes. It would be after line 17, where it says services, you would add in the least restrictive, comma, most family-like setting possible to meet the recipient's needs, period.
Okay, and do we have a motion on that? Oh, I'm sorry, let's get a motion to pass the bill.
Motion to pass HB 1238 LC 600227.
All right, we have a motion to pass, have a LC 600227, have a second, Senator Setzler, and we have an amendment. You read your amendment. Do we have, got a motion for the amendment from the author? Do I have a second?
Second.
Senator Orag gave us the second. All right, any further discussion on the amendment? I don't think so. All those in, hold on just a second.
I thought I had to turn on my, what does it say? Most, I didn't write these actually. Did you write it, sir? I got most of it.
Do you need a hyphen in there?
Yeah, family. Home life.
It's an adjective describing.
And the most.
I'm not, I'm not going to do the hyphens, so, I'm sorry. So, you know, no further discussions. All those in favor of the amendment, raise your hand. 1, 2, 3, 4, 5, 6. Okay. All those opposed? 1, 2. Okay. So the amendment passes. So now we're in the posture of passing LC 600227 as amended. All those in favor, raise your hand. Looks like we are unanimous. Okay, thank you so much.
Thank you.
All righty, and did you have someone to carry this
I
already?
believe Senator Hatchett is
Oh,
going to carry it.
yes, I think
actually.
he is,
seems to have
he
read
is
it very
certainly,
well, hasn't
he is owning that one. That's good. I appreciate that. All righty. There we go. Thank you so much. All right, and if you want to make those hyphen changes on the floor, you can have at it, but that works, yeah. So I was asked to put Representative Petrie from first to last, but in our committee, we're saving the best for last. So he is my state representative, Representative Petrie from the great state of Chatham. And, he's brought a crew with him. And, all righty, he's going to, we got HB 1097. LC 620404S. Make sure everybody has that in front of them, and hang on. Yeah, hang on just a second. Let's see. Where is that? Is it in here? Oh, here we go. No, I'm sorry. I overlooked it. It was so bright here. It is the pink one in our folder there, and you do have the summary there. And the man with the green jacket, it is yours.
Mr. Chairman, and I was wondering where your green jacket was today. You know, tomorrow
It's
is
not St. Patrick's Day yet,
It's,
so it's
tomorrow
close.
we're not in.
It's close. I got my green tie. All right, you're good.
All right. Chairman, thank you. So we're on LC 620404S. That is a substitute to House Bill 1097. This is a bill that was brought to me by the Department of Behavioral Health and Developmental Disabilities. As y'all may recall, to give you the backstory on this, last year we passed House Bill 584. I carried that measure, and what it did was move adult residential mental health programs, community living arrangements, drug abuse treatment programs, and narcotic treatment programs out from under the regulation of the Department of Community Health and move them to the Department of Behavioral Health and Developmental Disabilities. That was done in the interest of efficiency because those particular licensed programs are work underneath DBHDD anyway. So the licensure requirements that were dealt with by Community Health under healthcare facility regulation was dealing with all of them. Now they've been bifurcated in the interest of efficiency. What we failed to do at that time, it turned out, was to move the authority for DBHDD to do criminal record background checks. And so the genesis of this bill was to make sure that we have the ability, that DBHDD has the ability to do criminal background record checks. And so to that point, I will mention, I'm going to start with Section 2 first, and I'll be brief. But Section 2 is really where the bill began. And what you'll find there is several things. But the breadth of what we'll do, and I have two gentlemen here that will introduce themselves to you from DBHDD and GBI as needed. But to give you the theme here, we're giving the authority statutorily to DBHDD to do these criminal record background checks on individuals who work in these facilities. Obviously, it's real important when you're working with disadvantaged and disabled individuals that we know that we have people that have no criminal background, particularly in certain areas. So what you find here is we're giving the authority to do that. So we're granting DBHDD the statutory authority to conduct nationwide criminal history checks. And by the way, they're more rigorous here, I think is the best way to say that, than what they have today. Much of what's happening today are statewide background checks. And in a time when people migrate as they do, you don't really get much when you're doing a statewide background check. So these are criminal background check. And all of that is done through GBI in that process. I do want to mention that you'll see much of this measure is procedural, but on page, I want to call your attention to something real important, and that is wrap back. On page 13, lines 1317 to 1321, we're giving DBHDD not only ability to do these background checks, but for them and subsequently the providers that serve them to be automatically updated when there is a crime committed. And that is called wrap back, and that is not available today as well. So we've made it a more robust process, and now we've given the authority to DBHDD. Is there anything you two gentlemen would like to add to that so far? No, anything at all, sir? Anything? Not so far. Oh, man, I'm pretty good.
Tell us who you are and who you represent.
Yes.
Sure.
Good afternoon. I'm Tracy Altman. I am Deputy General Counsel for Programs with the Department of Behavioral Health and Developmental Disabilities.
Okay, great.
Good afternoon, Mr. Chairman. My name is Philip Curtis. I'm an attorney with the Georgia Bureau of Investigation. Thank you to the committee and thank you for the sponsor for bringing this bill.
Truly a multiple department.
Yes, multiple departments involved with this, and but less so than before, where you had DCH, DBH, DD, and GBI. So I will say then finally, and we'll take any questions, but the first section, Mr. Chairman, Section 1 then, came after the bill was introduced. That's why you have a sub. The governor's office added that piece, and that is a piece, and again, if we need assistance in describing this, but basically what we're doing here is trying to resolve having to do this in the future where we have to, by statute, give every department the ability to do criminal record checks. It has been discovered, as I understand, through the National Child Protection Act that that all agencies will be able to do criminal record checks on their own once we put this in statute, which is what Section 1 is. Anything you would add to that, sir?
Yes, sir. Mr. Chairman, just briefly, Section 1 allows all state agencies, just not DBD, DBHDD, to conduct national background checks according to FBI policy for those state agencies serving vulnerable populations. So
Okay.
it is a way for state agencies serving vulnerable populations to have access to that national background checks in hopes of getting national background checks for those individuals serving our most vulnerable populations.
Okay. We're going to have some questions. You finished with that?
Yeah, that's
Help me
good
before, and we'll come to you. Did you say wrap back? What do you say?
Wrap back, yeah.
Okay. and-
That's what we refer to it as. There's probably a better, how would you describe it, sir?
Well, it's how the FBI describes it, and it's an FBI program, so it's wrap
Wrap
back,
back.
and essentially what that means.
How do you spell that?
RAP space BACK.
And-
I've seen it hyphenated. No hyphenated. I've seen it not hyphenated.
Okay, so in other words, so you've checked somebody out and 2 years later they commit a felony and you get notified that they committed a felony because you
Yes, Chairman.
are in this particular.
And that is not the case today, so unfortunately, this is so superior. So if let's say you're a community living arrangement, you're serving intellectually disabled individuals, and you've hired somebody as a caregiver, and they have a clean criminal record. Well, you're not going to criminal record check them every year, and you're not required to. You criminal record check them when they're hired. If 2 years go by and they commit some crime that is on this list, right now, you aren't prompted on that. Wrap back, it goes straight to these guys, and then the provider learns, hey, this individual is no longer able to work in that facility. So all of this in the interest of protecting the vulnerable.
Thank you. Questions? Senator Robertson, you're on number 4.
Thank you. Appreciate it. I met with a group during the summer, and they had some concerns that they work with multiple state agencies, but they have to get a background check at every state agency and be fingerprinted at every state agency.
Yeah.
In other words, there's no one central place where they can be fingerprinted, have their criminal history done, and then be able to use that to work at multiple agencies. And I think that may be something we need to talk about in the future. But the criminal history will be run by somebody within DBHDD. Okay, so, and it will be run, I guess, they'll be running GCIC and NCIC, is that correct?
Well, the request, as I understand it, will go to GCIC, and GCIC would then forward it to NCIC.
Yes,
Right.
correct. They get both.
So do they have a TAC officer within that agency that's qualified to do that, to maintain, to follow the protocols of GCIC and NCIC?
They being any individual accessing the automated criminal record history information system must be qualified to do so. Yes, sir.
So how many individuals will be qualified to do that?
I do not know at each specific.
Because to be clear, it would be illegal for anyone to run a criminal history on anybody without that individual's permission, correct? The individual has to sign a waiver.
They consent.
Yes, they have.
If they want to participate, they give the agency the permission to run the criminal history, right?
Yes, sir.
Yes, sir. And Senator, to your good point, that is not only employees, it's employees its owners, and its contractors.
Right.
So anyone that could be in a situation with vulnerable adults where they could be harmed in some way is criminal record check. But they always give consent. It goes to the department, which contracts with GBI, as does DCH, to do the fingerprinting and background checks.
Well, I think every law enforcement agency in the state contracts with GBI
Yes,
for
sir. Yeah.
GCIC and
Yes, sir.
with an ORI number.
Just to
Yeah.
be clear, this is
Yeah.
for non-criminal
No,
justice
no,
purposes.
right.
So when you say law enforcement,
Well,
totally different method.
but what I'm talking about, law enforcement agencies still have to get a release from an employee, somebody that wants to come work for them. They have to sign that release before they can run GCIC via NCIC, and then if somebody runs somebody without that permission, then that is a criminal violation, correct?
Is it a criminal violation? I do not know. I know it is a administrative
It
violation.
is an administrative, but I believe there are criminal charges that can be brought. Maybe it's just under color of law, under
I
that
believe so.
side,
I
maybe
would have
so.
to look at that one.
Yeah, because everybody's criminal history is their criminal history.
That's correct.
And, okay, I just want to make sure. And the wrap back, why aren't these individuals, because, I'm not running through all the codes on here, but would there not be a reason why we would not run criminal histories annually?
What was the question? What was the question, Senator? I'm
Would
sorry.
there be a reason we would not want to run criminal histories annually?
Yes, sir. Well, it's a huge burden on providers. Yeah, running them annually would be. This is a far superior. This way, it's done, and you never worry about it again.
Well, it's
with wrap-back.
it's done unless there's a code, there's a violation of law that is not caught up in wrap back, correct?
Well, yeah, now, so to your point, yes. So in order to serve, there are certain offenses that are itemized here.
Right.
That they're looking for. Any violation of any law is not going to prohibit somebody from working in one of these locations. But these are the ones, and by the way, I know before you don't have, all you have is code sections.
Correct.
But if you'd like, I'll read them to you. Involuntary manslaughter, cruelty to children, abuse, neglect, and exploitation of a disabled adult or elder person, exploitation, intimidation of disabled adults, statutory rape, child molestation, enticing a child for indecent purposes, improper sexual contact of an employee, agent, or foster parent, arson, theft and related offenses, concealing the death of another person, failure of a mandated reporter, and then all the felony violations, crimes against the person, sexual offenses, forgery, controlled substances, criminal attempt, burglary, and operating an unlicensed personal care home.
And
So it's looking for those.
Aggravated assault.
Yes, sir.
Would be on there, and
Yes, sir.
and would any narcotics charges, anything of that nature, be included in that?
Yes.
And I
He said
see you
yes.
nodding your
Yeah,
head, yes.
These guys are the experts, yeah.
Okay. I just want to make sure, because it seems like a short list.
Controlled substance, that'd be
Right.
Chapter 13, Title 16, sir, yes,
Okay,
sir.
all right.
Controlled substances as well. So but if it hits one of those, that provider gets a letter that says you can't employ this person anymore. So it's a huge success. But going back to your initial question, for a provider to have, you're talking about caregivers.
Right.
Every year to send a caregiver to, spend $50 to do yet another fingerprint. It's very cumbersome, it's burdensome.
Well,
And it's difficult.
The criminal histories don't require fingerprints.
We are required to do fingerprints.
Right. What I'm saying
Every
is
year.
everybody's initially required to do fingerprints. Fingerprints never change. Criminal histories do. And so most agencies do just run the NCIC, GCIC criminal background. They run the fingerprints on the initial hire.
Yeah, in this realm, everybody's fingerprinted every time.
Yeah, and to be clear, fingerprints aren't like the old day. Everything's digital now and inkless and pretty smooth and easy, but I appreciate the legislation.
Thank you for the good questions.
Well, if you didn't have anybody else to carry this bill, then I think we got a really good one right here.
I think so as well.
Luckily, I've got somebody else to carry.
The 12, you're on, Senator Merritt, you're on 11, sorry.
Hey, hi.
Hey there, how are you?
I just needed clarifications on line 306, 307, 308. The immunity that's there, like you're collecting, it's protecting the state agencies for collecting all of this information, but if something is found wrong and somebody loses their job over it, I see the state has immunity from that.
Yes.
Can you explain?
I can't, that is customary, and so I'll let these guys speak more fully to that. But, yeah, the state is immune from an error they might have. And anything you gentlemen would like to add to that?
Grab that mic a little bit closer, so.
Yeah, if y'all like this.
It was 308, 306, 307, 308, 309, yeah.
Yes, again, customary. This language, like a lot of language in this bill, was actually carried over from existing legislation that allows the Department of Community Health to conduct its background checks. And this particular provision is also in DCH's legislation as well, in their statutory authorizations. But, yeah, I mean, it's always possible that somewhere along the line, say the FBI misreports something to us. It's to protect the state agency from facing liability for mistakes that we didn't make.
So it's just pretty standard practice
Right.
that y'all have liability.
Okay, Senator, Chairman Sessler. Thank
Thank
you.
you, Chairman. Fingerprints are used throughout here as kind of the identifier. Is there any authority in this granted at all to take DNA from people who are potential employees?
No, sir.
Okay. Is there any ability, and it's reference to the FBI, if the FBI changes their procedures to include DNA, would that come in by reference automatically?
It would not. The policy that governs, the FBI's policy that governs fingerprint-based national background checks for employment and licensing purposes is a law. It's a national law. So federal law would have to change for FBI policy to change as you're asking, sir.
Okay, that's, because that matters to me. I think there's a variety of opinions on the proper uses of DNA, and I think I'm just sensitive to people who are trying to work in this setting, and fingerprints all make sense to me. I just want to make sure we're locking that in.
This entire system is predicated on the 10 print, your 10 fingers.
So this is in our statute, but you're saying the federal framework the FBI operates under is in federal statute too. It's not an executive order can't be issued to change that.
No, sir.
Thank you.
So all those out there that did 23andMe, they're still safe there. So is that what you're saying? Okay. I got you. Yeah. So we are approaching, yes, the end of the meeting, and do I have a motion?
Move to pass, Mr. Chairman.
Move to pass.
Sir,
And-
Mr.
I'm
Chairman-
sorry, hang on
Mr. Chairman,
here.
I was just reminded of something, if I could interject. There is, why don't you explain it, sir?
One motion for, or at the appropriate time, a motion to amend.
Okay, let me get so we got the motion to pass, and we got a second, Senator Harrell, and now will be the appropriate time.
So for the committee's consideration on line 45 of the bill, there's a missing or, OR, whom the authorized agency or qualified entity provides care. There's-
Okay, so line 45, there should be
After agency.
It was
The
line,
authorized
whom the
agency-
authorized agency or qualified entity provides care.
Yes, sir.
Is that correct?
Yes, sir.
We clear on that, Legislative Council? Okay, is everybody clear on so basically line 45, after the word agency, we're putting the word or before qualified.
Yes, sir.
So moved, we have a second. Second, all right, and,
Some further discussion.
all right, further discussion.
Mr. Chairman, I just wanted to point out on line 210, you've got a hyphen between face to face and a hyphen between hands-on. So
You
maybe
know,
we
that
take
is-
those out on
I
the floor.
think that-
I don't know.
We got it right, Senator.
He doesn't like hyphens. I'm
No,
protecting
no,
my chairman here.
Yeah, you're right. You're exactly right. I appreciate that you pointing that out. I stand corrected. Okay, there we go. So you can.
Well, I mean, I'm more than happy to make an amendment. and take them
I
out.
think that Chairman Hatchett's got, Leader Hatchett, might need to discuss that with the governor, but I think it'd be okay to do a floor change on that one. Maybe even in rules might be the place to do that, that we can make that change. I really appreciate that, you pointing that out, so.
Looking at.
All right, so where were we? I got lost in that one. Whew. I think we are at, we need to vote on the amendment. All those in favor of the amendment, just say aye. All those opposed, like sign, unanimous. And so now we're voting on the underlying bill, LC 620404S as amended. That's House Bill 1097. All those in favor say aye. All those opposed, like sign, passes unanimously. All right, and did you have somebody that's going to carry that?
I really do not yet, sir.
Okay.
I need to-
Does anybody volunteer on the
I think
committee?
Senator Robertson already has that. Oh, Chairman Brass, I think.
Oh,
is gonna
Chairman
carry
Brass
this.
was asked.
They just told me, okay.
The powerful rules chairman will be doing that for us.
I love that idea, Chairman.
Thank you so much. Thank you, guys. We appreciate truly a department bill. We are, on Wednesday, we're still meeting. We got a little bit longer on Wednesday, so 2 hours on Wednesday. We're going to have a bunch of bills then, too, and some changes and some good bills. Meeting adjourned.